Thank you, Innovator MD, for inviting me to share a little bit about the exciting work going on at KelaHealth. Just by way of introduction, my name is Alan Young. I'm the head of clinical partnerships at KelaHealth. In addition, I serve on the National HIMSS Physician Committee, and here in SoCal, I sit on the local HIMSS committee as the CMIO committee chair. My clinical training was in orthopedics, and I started my career as a physician at Kaiser Permanente. But over the past 10 years, I've been working in management consulting, medical group operations, health IT strategy, and most recently, artificial intelligence. Prior to joining KelaHealth, I've been the chief medical officer at early stage digital health companies and startups trying to bring them from seed funding through Series A. So really excited to share what I'm working on with KelaHealth. I was really excited to join KelaHealth, mainly with a strong belief in the mission, but also the team. The team itself is an interdisciplinary group of data scientists, engineers, entrepreneurs, surgeons, and physicians. And our mission is to apply AI to the field of surgery for sustainable and measurable impact to improve the experience not only for patients, but also providers. We've gone through a couple of accelerator programs, including Techstars and Plug and Play, and are currently seed funded and looking to scale this coming year before we go for Series A near the end of 2021. So what does KelaHealth do? We're a dynamic surgical intelligence platform that helps predict each individual patient's risk for complications or readmissions using machine learning and the latest statistical methodologies applied to large amounts of data, primarily from the EMR, but also from any other data source that we can ingest into our cloud. And from that risk score, we can recommend differentiate clinical actions and interventions based on the individual risk for the patient. And as a result, monitor that patient as they go through surgery, they're discharged, and in the follow-up period, make sure that we track their outcomes so that our models can continuously learn and adapt to kind of the changing environment and understand how our risk scores have fared in the real world, and as a result, improve our risk scores over time. This takes place by kind of understanding the surgical journey for patients and being a part of that. So in this case, we have Maya, who's coming in to consult with her surgeon for a total knee replacement. And at the very beginning, right away, the surgeon can access the KelaHealth score to understand that patient's individual risk factors, whether or not they're a good candidate, what their chances are of developing a complication like a wound problem or a blood clot or any other issue. And during that time, then the surgical team can use that information to optimize the patient. They can either delay surgery, start them on a program to lose weight or stop smoking, improve their nutrition. And as a result, that will change their risk score. So by the time the surgeon is ready to do surgery, they can actually make a decision whether it's safe to go, whether or not they could be an inpatient procedure, or it can be done maybe in the same day, an outpatient procedure. So all of these things are able to help guide the surgical team in making these tough decisions as to where the patient should have surgery and when to have surgery. And as a result, afterwards, the KelaHealth score can also track the outcomes for the patient and return that information back to the surgical team on a regular basis to give them feedback on how they're doing. The way we worked is really to be embedded directly into the electronic health record. This is showing an example of how we work with Epic, how this dashboard can appear right within the Epic as an iframe. Our risk scores and interventions all displayed pretty cleanly and allow the surgeons and teams to kind of function within their existing workflow and having requirements to obviously document everything within the EMR. We also kind of move with the clinical teams and send kind of secure email messages directly to their mobile devices that are built to help fit into their busy schedules. If you have a surgery day or you're in post-op clinic or pre-op clinic, you can see what patients you're seeing, and this will give you a kind of a snapshot of what you need to do. A lot of surgeons really like this, and they don't even bother going into the main dashboard. This kind of mobile view gives them everything they need. We've already had a very good impact early, and being such an early stage startup. Some of our surgical partners include doctors and surgeons at Duke Health, Cedars-Sinai, Move Health, and Intuitive Surgical. Through different subspecialties and case studies, we've already demonstrated that we've been able to reduce readmissions by up to 20%. Surgical site infections have been reduced by 41%. And relative costs in one case were cut down by 50% when you take into account reducing the amount of complications you have, length of stay, readmissions, all those things. The other thing we're really proud of is really the engagement. Sometimes digital tools don't end up doing very well with clinicians, but we have a pretty high usage rate. 90% of all the predictions are viewed by the actual end users, and 81% of our users actually access the system daily, either through email or on the platform. So KelaHealth's vision for surgery of the future is really one where it's technology enabled and supported by data. And that data will allow surgeons and teams to make the right clinical decisions at the point of care. We also want to be able to adapt our platform to different subspecialties. Obviously, we haven't been able to tackle all the different types of surgeries out there, but we started in some areas and are expanding slowly. And we think that our platform can adapt to different subspecialties and their needs. We also want it to be very adoptable by clinicians and surgeons. We wanted them to want to use this product. We don't want to burden them with additional documentation. Our system actually pulls all the data, generates the information, and sends it to them, as opposed to many systems where clinicians are required to enter in data, create a report on their own, and pull data out of a system, which can be very onerous. We think this way is a little bit more user-friendly, and we can scale across multiple locations since we are a SaaS-based company and create software. So how do we maintain value in other areas? Well, we think that the 3 areas that we can help with are around patient growth, operational efficiencies, and quality outcomes. We really think that the digital age is coming, and as you know, oftentimes patients are now making decisions based on consumerism and choosing where they want to go and get their healthcare. So having this technology-enabled footprint, having a digital engagement strategy, and using AI and the latest technology will really help attract patients. And this idea of personalizing care and giving them their own individual risk scores is somewhat appealing to some sections of the consumer base. We really want to support having the right patient have the right surgery at the right time, and having the ability to optimize patients, plan ahead, and really make the best use of your limited resources, bed space, OR time, and deploying protocols that enforce kind of the best evidence-based care is something that KelaHealth can support. And as we mentioned, we really generate outcomes based on reducing complications and readmissions, improving overall patient safety, and avoiding costly penalties that come from Medicare or other types of programs related to poor performance. We exist in the cloud. We have a HIPAA-compliant AWS cloud-based system that ingests the data from the different sources. We run our machine learning algorithms, usually a number of different types, and provide the information and risk scores back into the client through their EHR, a web app, mobile device, or even in some cases, a PDF that we send to the physicians. We kind of trained our initial models on over 4 million patients, primarily from a surgical NSQIP database, looking at patients undergoing general surgery. The inputs number over 200. So we take in all of these different data points to run our ensemble machine learning models. And we're able to predict for up to 12 different kind of complication categories. 9 of them are specific for wound or cardiac or respiratory, and 3 of them are more related to kind of broader measures of readmission, reoperation, or even mortality. We think these things line up very nicely with some of the programs that currently exist that many organizations and hospitals have to kind of adhere to around hospital-acquired conditions, patient safety indicators, readmission reduction programs, and other capitated programs such as the bundled payment programs for orthopedics and other specialties. After we've done kind of this base training with all that data, actually take transfer learning to tailor our model for individual hospitals. So we don't believe that one size fits all for data science. We really want to get the data from our clients and their historical patient polls and their patients that they've done surgery on, and retrain our model in this way. And we found by doing so, we can actually increase the accuracy of some of our predictive capabilities by up to 20%. And we've done that already in an IRB study with one of our partners. So as a result, we feel that, KelaHealth can really contribute to improving the quadruple aim through technology. We've talked about clinician experience, how this is something that they'll use on a regular basis that intersects nicely with their workflows. We've talked about improving outcomes with fewer complications, fewer readmissions, fewer acute cases of acute kidney injury. And obviously this all leads to lower cost. We believe that, value will drive volume. So if you're in an organization that's thinking of moving from a fee-for-service or volume-based practice, and you have to focus on quality and value, we still really feel strongly that having a high-value, high-quality system will eventually lead to greater volume as well, because more consumers and patients are seeking the best care possible. And they're very data driven and trying to find, you know, where technology can improve things beyond what traditional medicine has been able to do. So with that, I wanted to thank everyone for your time this, you know, afternoon. Appreciate everyone jumping in, and especially, you know, my physician colleagues. Hope, you know, you've had a good day at work, and this is somewhat of a refreshing kind of time for you to network with some of your colleagues in innovation. And thanks again to the team at Innovator for having me.